All right. Welcome, Erin. Thanks so much for joining us today.
Thanks for having me.
Of course. And to get started, let's just have you tell us a little bit about yourself and what inspired you to start your self-directed lab company.
Thank you so much. Yep. So I was really drawn to any lab tests now, both personally and professionally. So personally, a couple years ago, I was kind of building my family, growing our family. I was dealing with some fertility challenges, and throughout that journey, started to need some specialty lab draws. And I kind of had a difficult time getting what I needed, right? I was working with multiple different doctors and different specialties, some out of state even. And so it really felt like I was kind of quarterbacking my own care. And like many people do, I think it's not a unique story. But then I sort of found, direct to patient lab testing, and it was late in the process, so I had certainly, wish I'd found it earlier. But I just realized how helpful it was for me and kind of what I was going through, and realized how many other people that it could help it if they had known about it.
Yeah.
So that's sort of the personal half. And then professionally, I've been in corporate America. I've been doing software development and business optimization for many years, and was ready to do my own thing and work for myself and grow something that I'm very passionate about. And so when I found this Indie Lab Test Now opportunity, I kind of jumped on it. And so we own 2 locations here in Kansas City.
I love that.
Yeah. So for those, let's just say for those that aren't familiar with it, how would you explain what this process is? Explain.
Great question. So traditionally, we'll just kind of talk about kind of the norm or the traditional, and sort of then kind of jump into a little bit how we're different. So traditionally, for someone to get a lab drawn, like they need a certain test, they'll need a doctor's order for that. And sometimes for that doctor's order, they'll need a doctor's appointment, right? And that can take months. So they will get that lab order, they'll get their blood drawn, and the results will go to the physician. So with this kind of often insurance is usually sometimes in the middle of this, which is great, but may not be available or optimal in a lot of situations.
Or doesn't get approved.
Or get approved. The pricing is sometimes unclear. So there's a lot of question marks in that process, right?
Right.
But at Any Lab Test Now, or the direct to consumer model, is really meant, what this means is that you don't need a doctor's order and you don't need insurance. You walk into one of our lab locations and you can get any test performed that you want. And a patient will come in, they'll pay a transparent price one time, nothing surprise after the fact, and the results will come to them, as soon as they're available. So it really kind of helps people take charge, a little bit of that sort of quarterbacking your own care kind of mentality I mentioned before. And it's great for those kinds of patients in those kind of cases.
Yeah, I think that is such a great service to provide, especially because it does take so long to get into providers these days.
Absolutely.
So this gives the patient some latitude to at least get the ball rolling so that they have more information once that appointment time even comes up.
Absolutely. Yeah.
So what kinds of patients are you typically seeing that use your service since you've opened?
Yeah. So we really see all kinds of patients. So in terms of our clinical offering, like we just mentioned, right? People who have maybe run into roadblocks dealing with insurance, or dealing with, providers that they can't get into, or people with high deductibles, people who have insurance, but maybe find that our prices are cheaper or just as competitive, even compared to paying with insurance. And then people being proactive, right? So you just hit the nail on the head, right? It takes so long to get into the provider. It takes maybe months to get an appointment. We'll see a lot of folks say, okay, I've got an appointment with my doctor 2 months from now. When should I come in and get my labs? So that when I do, go see them and have that appointment, it's a really productive conversation, right? They have labs already there to discuss, and they can get on a kind of a treatment plan or a protocol, what have you, and they're already armed with that information. So seeing proactive people is a lot of what we see there too.
Yes, that's great.
Yeah. Are there some popular labs or trends that you kind of see occurring right now at all?
Yeah, I mean, we definitely see a lot of sort of the basic health marker labs being ordered. So CBC, CMP, metabolic panels, lipid panels, those are all common. A lot of hormone levels and biomarkers that we look for there. It's also sort of back to school season. So we see a lot of titers of
That's true.
tests that kids need to go to school, or doing, clinical programs for work, things like that.
Sure.
Annual checkup panels, micronutrient assays. So we see a lot at the lab. And that's really just sort of our clinical piece of the pie. We also do other types of testing too. So we're seeing a decent uptick and a lot of interest in food sensitivity and allergy testing, which is really kind of interesting. I think there's, a lot of interest in sort of personalized, diet. How does my body sort of respond to various, either foods or environmental influences?
Yeah.
And then the menu it grows even further, right? We do drug testing for corporations for hiring and legal situations. We do DNA testing for family relationships, STD testing, and also nutritional injections like B12.
Okay. Yeah. This is something that I actually hadn't thought about before. Do you do cultures?
We'll need some advance notice, but yes, we can do those as well.
Okay.
Yeah. So I guess for the individual that maybe has a little hesitancy of trying to get labs like this drawn on their own, do you obviously I'm sure that you can speak to this, but excuse me, but what about the accuracy? Is the accuracy of what you guys have through your lab design match, the other traditional LabCorp Quest type stuff?
Absolutely. So in fact, we partner with a lot of those same labs. So we're using a lot of the same labs. We partner only with sort of accredited and sort of, best in class clinical and also specialty labs or reference labs and specialty labs. And so a lot of those will be the similar reference ranges, and results are pretty quick as well. So between 24 to 72 hours roughly on those result turnaround times.
Oh, that's great.
I'm sure some labs are a little bit longer because of the complexity of those, but
Yeah, it's an average. It sort of depends on the test,
varies.
but in
It
general.
varies.
For those healthcare providers out there like ourselves who are working outside of insurance, how can they partner with you to support patient education and empowerment?
Yeah, absolutely. That's a great question. So I sort of mentioned, we're sort of a direct to consumer, model, but the sort of other half of that coin is that we love to work with providers, right? Especially like you mentioned, sort of outside of that traditional insurance model. And we really like to sort of customize various panels or various, I'm sort of there, the lab is really there to sort of help you support your personalized programs and your personalized medicine. And I think that's really where we shine.
Yeah.
So, I know we've talked a little bit about Revelation Health and, developing sort of how can we support, your guys' getting the information that you need about your patients and the various levels you're looking for and monitoring over the course of treatment. And that's, we're happy to be flexible with that and support you guys, the providers, as much as we can.
Yeah. And I feel that is a really great thing for really all providers, because there are even providers that work within insurance. A lot of times they feel like their hands are tied as far as ordering certain labs that they know won't be approved by insurance. But knowing that there are other avenues out there that are very cost effective to get these labs, it's a great service.
Yeah. Yeah. I had a question, but now I forgot what it is.
Oh,
Testing packages for an individual that maybe they don't know what they want. They want to check their metabolic profiles, or specifically, maybe I want to look at my specific hormones, but I don't know which hormones I need to be checking. Do you have categories or profiles or groupings, if you will, that folks can just come in and order that stuff?
Yes, absolutely. So we offer something crazy like 8,000 tests. And so that can be very daunting, especially as sort of the typical consumer who maybe didn't go to medical school, those kinds of things. But we do have grouped sort of panels put together already that sort of help a consumer focus on, particular areas or really do a deep dive into a particular part of their health. We also have a little promotion thing going where it's build your own panel. So if you know that you wanted a couple markers or a couple different lab tests, but weren't sure on the others, we can sort of help fill in the gaps with those. And there's a certain price promotion. I think it's 3 tests for $89 is that promotion, build your own.
okay. Excellent. And I love the transparency. I know you've talked about it already, but it's so nice to know the exact amount that you're going to be paying for the labs that you're getting.
Yeah.
Absolutely. Yeah, that's a big part of it. And especially something that I remember too is, and when it comes to your health, I just remember feeling, well, I have to do this, whether it's a procedure or a test or whatever it is. It's like, I have to do it because it's my life, it's my health, it's my, organ, whatever it is. But then, months later, getting that insurance bill or, the denied claim or whatever it is can sort of just drag it out. So this is very, we're kind of all above board. It's very kind of, you get you know what you're getting at the very outset, which is nice.
Yeah.
And y'all do the allergy testing too. Is this correct?
Allergy testing?
Yes.
Yes.
RAST allergy testing, all that. Correct.
Mhm.
So some folks, I'm sure, there's various different times of the year, season that they want to know, like, am I allergic to this? So it's something that would be helpful for them to be able to go in and get that potentially. So,
Absolutely. And that's nice because that's a blood test and not one of those crazy, you know, they turn your whole back into those spots with the
think cushion door.
blood.
Yes.
So, yes.
Exactly. Well, what are some of the locations that patients potentially could come to see you guys and get their testing done at?
Yeah. So great question. So Any Lab Test Now is a franchise model. So there are something like 260 locations across the US. But here in the Kansas City metro area, there are two. The Overland Park location is about 119th and Metcalf-ish. And our Independence location is right there near Costco. So nice and convenient locations with some good hours as well.
Awesome. Very accessible.
That's
Awesome. Well, I don't know if I've got any other questions specifically.
I assume, I guess your pricing, is that when you go online, can somebody just see what the pricing is for if they're searching?
Absolutely. Yes. So our website, there's a ton of information, a lot of details and sort of like specifics about each test, which is listed online. So for example, do I need to fast for this test? The website will tell you yes or no.
Okay.
You can also go all the way through. You can book your appointment. You can pay for the test all online before you get there. You can fill out your paperwork. And so a lot of times our people are in and out within 10, 15 minutes. Even without having done a lot of that upfront work, we're pretty speedy when people come in. So it's a nice sort of, you know, light and breezy experience, maybe unlike some other experiences there.
And walk-ins, assume that you guys will take walk-ins too if there's available.
Absolutely. Yeah. We can do appointments online and as well as over the phone, but walk-ins are always welcome.
Yeah, that's awesome.
Okay. Excellent.
Very good.
Well, is there anything else that you can think that we need to know about your service, or have we, and we've covered quite a bit?
We have. Yeah. I appreciate the opportunity to chat with you and chat with your listeners and come in and see us.
That sounds wonderful.
It's all about convenience, you know, and it's easier to get something done. It's a lot easier to manage that. So that's nice to have that opportunity for the patient. So we appreciate that.
All right. Well, we will definitely link all your information in the show notes so that people can find you. And we just appreciate you taking the time for the visit.
Thank you so much.
Thanks, Erin.
Have a good one.